Is it safe to take a prescribed benzodiazepine for life? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I talked a lot about benzos on this app, but one of the questions that's come up multiple times is it safe to take a benzo for life? So in general, we do recommend that benzodiazepines be used for short-term use and as needed. However, before you scroll on, in practice, this is often not what happens. And that's because prescribing habits have changed over time. When these medications were first started, back in like the 60s, 70s, 80s, 90s, it was normal for people to be prescribed these medications once, twice, 3 times a day, indefinitely with no plan for taper or discontinuation. However, with more clinical experience, we've learned that over time, there are risks to taking this medication. So this includes things like cognitive issues. There is an association with developing dementia, as well as other associated neurologic issues like tinnitus, gait issues, cognitive dulling, concentration, attention issues. And these can be associated with or separate from something called BIND, or benzodiazepine-induced neurologic dysfunction. And this is when people can have a wide variety of neurologic symptoms just from being exposed to a benzodiazepine for years and years. So this can be the cognitive symptoms that I mentioned, but also anxiety, fatigue, insomnia, sensory sensitivities, numbness, tingling, GI issues, and many other symptoms. And because of the coordination issues and dizziness, there is an increased risk of falls in the elderly. So for all these reasons, we generally don't recommend taking this medication for life. However, there are cases in which the risks of taking a patient off of a benzodiazepine are greater than the risks of them continuing to stay on the benzodiazepine. There are lots of younger people for whom tapering off of a benzodiazepine is incredibly challenging. But for this population in particular, it's crucial that we take a hyperbolic taper approach, meaning decreasing by a percentage of the dose with each dose reduction rather than a set milligram amount. But of course, it's also important to take into account what the patient's preferences and desires are. So if I have an 80-year-old patient who's been on alprazolam for the last 35 years, which I do, how do I approach that? So assuming that there's no misuse or acute safety concern, like they had a fall and we thought that it was related to the medication, then the approach I'm going to take is 1, informing them about the risks that I mentioned before, 2, asking them what their goals are, and 3, coming up with a treatment plan together to mitigate risk. So if the patient has no desire to get off of the medication or to decrease the dosage, and they understand the risks, and there's no abuse, and there's no acute safety concerns, then I don't have any reason to force them to get off. And that's not my role. My role is to support them. If there is a safety concern or if there is concern about abuse, then in those situations, I may say we have to decrease the dose. But in the majority of cases, when I talk about these risks, the person is interested in decreasing their risk, right? Often this looks like just decreasing the dose to something that is still managing their symptoms, not sending them into severe withdrawal symptoms, but also lessening the risk of all of those potential cognitive and other neurologic changes. Most of the patients in this category, I don't have the expectation that we will taper them to completion. Of course, if it happens, phenomenal. But I'm curious to hear from you all. If you've been on a benzodiazepine for years and years and you've been able to taper off or taper down, I'd love to hear about your experience and what was helpful to you in that process and maybe what wasn't helpful to you. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.